welcome back. The HPV vaccination campaign, which runs until 15th August, is a critical step in safeguarding the health of Namibian girls by protecting them from cervical cancer, one of the most preventable yet deadly diseases amongst women. HPV is the leading cause of cervical cancer, and this campaign aims to curb its impact through early prevention. Now, to discuss the importance, this evening we're joined by Mr. Walter Kamaya, who is the PRO at the Ministry of Health. Mr. Kamaya, good evening. Thank you so much for joining us.
Good evening to you too, and good evening to the viewers.
Well, Mr. Kamaya, just to start with, the campaign started on the 4th of August and will go up until the 15th of August. Talk to us about how it's been received so far.
Yes, the Minister of Health and Social Services, in collaboration with the Minister of Education, Innovation, Youth, Sports and Culture, we have deployed teams in all 14 regions to conduct the campaign. So the campaign has been received very well. For myself, who is based in Zambezi, and the reports from all other 13 regions, it has indicated that the schools, the community, the traditional leaders, the church-based organizations, they are receiving these vaccines with hope. Given that this is not all the way the two ministries have packaged their information. It's only that they thought that maybe it's a new thing that the government of the Republic of Namibia is introducing to them. But when we have spoken to them to say HPV vaccine has been there for a very long time, especially in private sector. So we just tried to convince them to say that this is what the government of the Republic of Namibia is doing, just to introduce it in public health facilities. And then we have explained to them to say that this vaccine is effective. It protects them not from getting cervical cancer, the girls and so forth. And then it's voluntarily, so the reception as well as the understanding, it's positive. People are coming forth. In some schools, we are vaccinating 100% eligible girls that ought to be vaccinated. If there are those ones who are trying to be anti about it, after we engage them, definitely even them, they've understood the message. And then the numbers that we are receiving in terms of the statistics that we are receiving in terms of vaccination campaign, they are so positive.
Talk to us about who's eligible for the HPV vaccine during this campaign, Mr. Kamaya.
Yes, the girls are between 9 to 14 girls. Those are the eligible girls that we are vaccinating. Years, 14 to 15 years old, those are the eligible girls that we are vaccinating before they have become actively into relationships. That's where we want to catch them at that age and get them prevented from that. And then the other issue also, we are also telling them about many other vaccines that they have been receiving, that they have been injected, that this one also is not far from protecting them. So those are the eligible girls.
Just lastly, Mr. Kamaya, beyond the campaign, what long-term strategies does the ministry have in place to reduce cases of cervical cancer in Namibia?
Sorry?
My question was that beyond this campaign, talk to us a bit about the long-term strategies that the Ministry of Health might have in place to reduce cases of cervical cancer within the country.
Yes, the campaign is one of them. These are the long-term, these are the protective measures. The other issue also that the ministry is conducting, we always used to give public health education to people, informing them that they should go for regular checkups, be it breast cancer, cervical cancer. People, they should go to facilities for regular checkups and screening, so that when it is detected at an early stage, it can be cured. But in most cases, if it's been detected at a later stages, it's difficult to to be able to contain it or to treat it. So in terms of the long term, this is the protection that the ministry is embarking on, as well as the usual one for screening, regular screening.
Mr. Walters Kamaya, we appreciate your time. Thank you so much for joining us this evening here on the Daily Roundup.
It was a pleasure having me. Good night. Bye-bye.
That was Mr. Walters Kamaya, PRO from the Ministry of Health, speaking to us about the ministry's HPV campaign currently underway. It started on the 4th and it will be running until the 15th. They're going around schools throughout all the 14 regions of Namibia where they will be doing these vaccinations aimed at young girls. Before you make a decision, or rather to help you make an informed decision, please do reach out to your nearest health professionals to understand what the HPV vaccination's advantages are. On that